Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, Crutzfeldt, Crutzfeldt Jakob disease. Okay, Crutzfeldt Jakob disease. It is a prion disease. Okay, this Creutzfeldt Jakob disease can be transmitted either as an infectious agent or it can be transmitted by congenital or by degenerative mode. 10 to actually 10 to 50 12% of cases of Creutzfeldt Jakob disease are familial cases. Okay, if you do a light microscopy of the Creutzfeldt Jakob disease, you will see presence of spongiform degeneration is seen. Because of this spongiform degeneration, the brain becomes sponge-like structure. What does sponge contain? Sponge contains small holes. So in Creutzfeldt Jakob disease, you will see small holes that are nothing but tiny cavities are present in the brain. And along with that, we see that whenever there is some degeneration in the brain, the other cells like astrocytes starts to increase, and thus it results in astrocytic gliosis will occur. Okay, and one important thing in Creutzfeldt Jakob disease or any prion disease is there is lack of inflammatory response is seen in the Creutzfeldt Jakob disease, which is an important feature. And one more important thing is in Creutzfeldt Jakob disease, the gene of prion is important. It is located on the chromosome 20, and this it is located on chromosome 20. Creutzfeldt Jakob disease is hereditary in 10% of the cases. So the infection in Creutzfeldt Jakob disease mainly develops because of, so the illness here can either develop from infection or it can occur due to the somatic and germ cell mutations. Either of these can result in Creutzfeldt Jakob disease. In Creutzfeldt Jakob disease, there is a marker which is CSF 1433 is a protein marker which is seen in CSF in Creutzfeldt Jakob disease. This Creutzfeldt Jakob disease or any prion diseases can also be transplanted, or they are also transmitted in the corneal transplant also. Here the patient with Creutzfeldt Jakob disease will develop rapidly progressive severe the patient will develop rapidly progressive severe dementia along with cerebellar ataxia with diffuse myoclonic jerks are also seen in the patient. Okay, the patient will develop dementia, the patient will develop cerebellar ataxia, and the patient will also develop myoclonic jerks, which is important. Then sometimes the patient also develop cortical blindness is common. Okay, then if you do an EEG, you will see that there is periodic discharges are seen with abnormal background rhythm, right? And death can occur within several months of onset of the disease. The patient can go through the death. And if you do a normal CT scan or MRI, CT scan and MRI will be completely normal. And in the CSF, this CSF 1433 protein marker is very important. And if this protein marker is positive, if this is positive, there is no need for biopsy. If this is positive, we do not need to go to biopsy. But if you were asked what is the most accurate test of Creutzfeldt Jakob disease, the most accurate test for Creutzfeldt Jakob disease is obviously biopsy. There is no specific therapy is not there for Creutzfeldt Jakob disease.
thank you and thank you for watching.